Hello, my name's Alison Barnes. I'm a Wiradjuri woman and I work in the School of Nursing and Midwifery at Western Sydney University. Today, I'd like to talk to you briefly about deficit discourse and strengths-based approaches in relation to Aboriginal and Torres Strait Islander health. I'm doing this because I think sometimes people find it a little bit confusing, so I'm hoping that I can speak about it in very plain English kind of terms. So, deficit discourse refers to a discourse or narrative or the story that we tell that represents people or groups in terms of deficiency, absence, lack, or failure. So, we're telling a story about people, but we're only doing it in bad terms. And we're not just doing that, but we're also laying the blame for the problems that those people or that community faces at the feet of the people who are experiencing the problem. So the people least able to do anything about fixing it. This overlooks the bigger socioeconomic structures that those problems are embedded in. So it overlooks the social determinants of health and how they impact people's lives. Deficit thinking has been identified as a barrier to improving health outcomes for Aboriginal and Torres Strait Islander people. So if you go to the doctors and the doctor says to you, what's wrong and what did you do to cause that wrong, that's the kind of thing I'm talking about. And doctors do that all the time, don't they? Anyway, a strength-based approach is not a set of policies or programs, rather it's a conceptual framework for approaching health promotion and clinical care, which doesn't necessarily sound like I'm using plain English, does it? What that means is it's a way of telling a story about a person or community in a way that highlights their strengths, the things that make them strong and resilient and capable. And research has found that this strength-based approach is, when it's being used, it's well liked by the people who it's talking about or being applied to. And it's actually successful in changing the story within the broader community. Strengths-based approaches are not a simple Pollyanna-ish antidote to deficit. At the same time, by explicitly acknowledging a desire to overcome a deficit-based model, a strengths-based approach can be highly effective for shifting or changing the story about Aboriginal Torres Strait Islander people and their health. It can also be seen to provide alternative ways to deal with health issues. So why do we do this? Have you ever heard the saying, how if you repeat something often enough, it becomes the truth? Or have you heard of people talking about a self-fulfilling prophecy? If we only ever speak of Aboriginal and Torres Strait Islander health in terms of how bad it is, how terrible it is, the terrible statistics, the health outcomes that are dreadful, the appalling stories that we hear, that's going to be the truth. It's not just the truth it's the truth that we create, because it's not the actual truth. Because that story leaves out the strength and the resilience and the capabilities of Aboriginal and Torres Strait Islander people to overcome their problems, the vast majority of which are not of their own making. So, if we speak in terms of strength-based approaches, we allow people the opportunity to be better than their circumstances. And that's got to be a good thing, hasn't it? If we allow people to be better than their circumstances, if we tell a different story about those people, my people, it means all those times over the years, and I've been nursing for 30 years, so I've heard lots and lots of times in tea rooms and handovers and clinical meetings about how bad Aboriginal people are and how they don't look after themselves and they don't care about themselves, and we tell all the bad stories. But when we tell those bad stories in our tea rooms and handovers, they become the truth. But they're not the truth. And if we speak in deficit terms like that, we allow systemic racism to continue. And we know that systemic racism kills people. Research shows that reframing the conversation can have a positive impact on health and well-being, not just for Aboriginal and Torres Strait Islander people, but for all people. The 2020 Closing the Gap report clearly showed that what we have been doing since 2008 has not worked. So it's well past time to try something different. If you'd like to know more about this, check out the Deficit Discourse and Strength-Based Approaches report published by the Lowitja Institute. So hopefully I'll get to see you in class. Good way you. See you later.